Hello, I am Jeffrey Shahidullah. I'm a pediatric psychologist in Developmental and Behavioral Pediatrics. So healthcare really allows me to live a professional career, at least in accordance with my value system. So I get to help people in a meaningful way. I get to work as part of a team where we all have different expertise, and only when we put those different expertise together can we solve problems that we probably couldn't solve working in isolation. And so that team is working with healthcare providers and patients and their families. And it's also a job that forces me to continue to learn, to expand my knowledge and my skills. As a psychologist working in developmental and behavioral pediatrics, I get to work with really young infants, toddlers on the early end of the lifespan. And for me, that's really gratifying because we know that with children, the earlier you intervene, the better the outcomes. So working in developmental behavioral pediatrics, one of the things we do is just respond to the parent concerns that they come in with, but also I really take a prevention approach. What are those tricky transitions coming up in life, and how can I work with families to optimize those outcomes? Or even when there are no major concerns, kids are doing well in school, with social peer situations, with health, emotional well-being. I always like to focus on a few minutes of just prevention. So what are positive parenting practices? What's the importance of reading to your kids at home and providing exposure to quality language and how that affects brain development later on? I think for me, one of the most important things is just having a mindful presence when I'm with families. I may have heard the clinical concern that they come in with 100 times before, and I may have really good advice or strategies or recommendations, but I also know that if that family doesn't feel heard and listened to, if they don't feel involved in the decision-making process and don't feel empowered that they can actually use the strategies that we talk about, anything that I tell them won't go very far. One of the things that I really enjoy the most is working with parents around common, everyday changes that their young children go through. They're changing so rapidly in the first few years of life. And so really seeing parents blossom in their parenting skills and feel that they do have the power, the capacity to make positive changes in their kids' life that maybe they didn't feel that they had before. The strategies, the advice that I give is never as cut and dry as it was before I had kids. I'm always a little bit more sensitive to those troubleshooting. I'm more aware of how parents can know the right strategies to use, but how parenting stress comes into play as a father of 3 kids. When I'm not working here at Dell Children's, I try to spend as much time with my family, my wife and 3 kids as possible. One of the things that we enjoy doing is just traveling, going to new places, new cities, and just exploring and doing new things.